endoscopy or colonoscopy is an exam of the lower part of the GI tract, which is called colon or large intestine. Colonoscopy is a safe procedure that provides information other tests may not be able to give. Colonoscopies are performed by inserting a device called the colonoscope into the anus and advancing through the entire colon. The procedure generally takes between 20 to maybe an hour long. Why do you need a colonoscopy? It's used to screen for colon polyps, precancer or colon cancer, rectal bleeding, a change in bowel habits like persistent diarrhea or iron deficiency anemia, which is a decrease in the blood count due to loss of iron, a family history of colon cancer, a personal history of colon cancer or polyps, chronic unexplained abdominal or rectal pain, an abnormal CT scan. How do you prepare for your colonoscopy? Before your colonoscopy, your colon must be completely cleaned out so that we can see any abnormal areas. This is vitally important to increase the chances that we will identify abnormalities in your colon. If your colon is not completely cleaned out, the chances we will miss abnormalities increases. We will provide specific instructions about how you should prepare for your colonoscopy. Be sure to read these instructions as soon as you get them so you'll know how to take the preparation and whether you need to make any changes to your medications or diet. You will need to avoid solid food for at least 1 day before your procedure. You should also drink plenty of clear fluids on the day before the test. You can drink clear fluids, a liquid that you can hold up to the light and see through up to several hours before your procedure. This includes water, clear broth such as beef, chicken, vegetable broth, coffee or tea without milk, and then also to clean up the colon, you will need to take a strong laxative to empty your bowels. You may be asked to take the entire preparation the night before the test, or you may be asked to take it in 2 doses, with the second dose taken 4 to 6 hours prior to the colonoscopy. Taking the preparation in the 2-split dose method may help get the colon even cleaner. This may require you to wake up early in the morning to complete the preparation. The instructions you are given will tell you how you should take the preparation. A commonly used preparation is a 4-liter solution that is obtained at the pharmacy. Drinking the solution may be the most unpleasant part of the whole experience. Water diarrhea is the desired result, and the end result should be diarrhea that looks similar to urine. If you become nauseated while drinking the solution, try temporarily stopping drinking and then going for a little bit of a walk, and then resume drinking at a slower pace. What should you do with your home medications? You can take most prescription and non-prescription medicines right up to the day of the colonoscopy. We will tell you what medicines to stop. Some medicines increase the risk of heavy bleeding if you have a polyp removed during the colonoscopy. Ask how to stop these medicines and when to stop these medications, including warfarin, clopidogrel, Plavix, or any other medications, including anticoagulants, blood thinning medicines. Do not stop these medications without first talking with your doctor. How do you get home after your procedure? Most patients are given a sedative, which is a medicine to help you relax during the colonoscopy. So you will need someone to take you home after your test. Although you will be awake by the time you go home, the sedative and anesthetic medicines cause changes in reflexes and judgment that can interfere with your ability to make decisions, similar to the effects of alcohol. You will not be able to drive home or go back to work after the examination if you receive sedation for the procedure. You should be able to return to work the next day. What happened the day of your colonoscopy? Prior to the procedure, you will sign a consent. An IV line will be inserted. Your blood pressure, heart rate, and breathing will be monitored during the procedure. You'll be given fluid and medicines through the IV line. With assistance of an anesthesiologist, an anesthetic agent, for example, propofol, will be given, which will put you to sleep while you're being closely monitored. The colonoscope is a long, flexible tube, approximately the diameter of the index finger. The scope will gently pump air or carbon dioxide and sterile water through the scope into the colon to inflate it and allow us to see the entire colon. During the procedure, a biopsy, which is a small piece of tissue or polyp, may be taken. Polyps are growths of tissue that can range in size from the tip of a pen to several inches. Most polyps are benign, non-cancerous, However, some polyps can become cancerous if allowed to grow for a long time. Having a polyp removed does not hurt. What happens after your colonoscopy? After the colonoscopy, you will be observed in the recovery area, usually for around 30 to 60 minutes, until the effects of the sedative medication wear off. Although many people worry about being uncomfortable during colonoscopy, most people tolerate it very well and feel fine afterwards. The most common complaint after colonoscopy is feeling a little bit bloated and having gas cramps. You should pass gas and not feel embarrassed doing this either during or after the procedure. This will relieve your feelings of bloating and cramping. You may also feel groggy from the sedation medications. You should not return to work, drive, or drink alcohol that day. Most people are able to eat normally after the test. A virtual follow-up appointment will be arranged to review all the results, including biopsies, in 4 to 6 weeks. What are the risks of a colonoscopy? Overall, colonoscopy is a safe procedure, and complications are rare but can occur. Bleeding can occur from biopsies or the removal of a polyp, but is usually minimal and stops on its own. Bleeding requiring further investigation is less than 1 in 1,000. The colonoscope can cause a tear or hole in the colon. This is a serious problem that sometimes requires surgery to repair, but it does not happen commonly, 1 in 10,000. It is possible to have side effects from the sedative medicines, like nausea or vomiting. There could be heart complications in 1 in 1,000 or less. Although colonoscopy is the best test to examine the colon, it is possible for even the most skilled doctors to miss or overlook an abnormal area in the colon. After the procedure, when should you seek medical help? Severe abdominal pain, a firm distended abdomen, vomiting, fever, passage of red blood, or black material in the stool.